Hello, everyone. I'm Leonel August Rodriguez, the VP of Business Development for Access Medical Labs. I'd like to thank everyone for joining us on another Access Live, where we bring you insights from leading medical experts. We do ask that all questions are submitted via the Q&A, as they will be answered at the end of our lecture. Ladies and gentlemen, I am thrilled to have a distinguished expert in lifestyle medicine, holistic health, leading today's session. With a unique background that spans from performing as a prima ballerina to becoming a highly respected plastic surgeon. Our speaker has demonstrated a lifelong commitment to balancing high performance with personal well-being. Her remarkable journey, which ultimately led her to embrace lifestyle medicine, has provided her with invaluable insights into holistic health and wellness. Today's webinar will explore the booming GLP-1 drug market and the critical role the gut microbiome plays in metabolic health. Our speaker will share her expert knowledge on how these trends are influencing the future of wellness and their implications for both individuals and healthcare professionals. Without further ado, please join me in welcoming today's expert, Dr. Lovelle.
Many thanks, and let me just put that up there. I also want to let everyone know, if you have questions going along, put them, as they mentioned, in the question area. But also, if you have something and want to respond, put it in the chat, because I'll be able to follow the chat as we're going along. So with that in mind, my very first question for you is, how many of you are already using GLP-1, GIPs in your practice? If you can put that in the chat, just so that I'll know. Either, raise your hand, that works as well, or you can put it in the chat. I see 4, 5, 6, 7, so quite a few of you. Excellent. Okay, so how many of you can put those down, how many of you are completely satisfied with the results you're getting and how your patients are reacting to these medications? Again, let's see, how many? So, yeah, quite a few still here. Not as many, but quite a few. All right, so let's talk about these things and what we're going to be covering today. Number one, we're going to look about the growing incidence of obesity and metabolic diseases globally, because let's face it, they are going up. Number two, we're going to look at that recent boom, as we were just talking about, in this weight loss pharmacotherapy, and know that this is nothing brand new. We're going to be talking about how this has been going on for decades, right? We're going to look at that interplay between stress, the gut microbiome, and the dynamics between these new medications, because there is a big interaction between all of them. And then finally, I want to provide you with some insights that you can follow and some advanced knowledge so that you can take this and work and get even better results with your patients and clients going forward. So I had already had a wonderful introduction. I want to just kind of give you a brief overview again. This is my third career. The first one, as was mentioned, I was a prima ballerina. And the reason that I mention and bring it up is because some of the things that I did during those years, trying to stay real thin, because ballerinas have to be thin, thin, thin. Some of the things that I did then impacted my life going forward. And I'll show those to you a little bit later. I was then a plastic surgeon for 22 years, loved it, would probably still be doing surgery if I could just do the surgery without all the other stuff that goes along with it, but you can't. However, those two things, the show must go on in dancing, and guess what? The show must go on in plastic surgery as well. So if you're not feeling well, you keep going, right? As many of us do. Putting those together, year after year, eventually I ended up in the intensive care unit 3 times in the space of a year. That third time, I almost didn't make it out. And that's when I realized that I had to change the way I was living. That constant stress, always on, never backing down attitude was making it so difficult for me to go forward. So that's what I learned about lifestyle health. And that's what I'm going to be sharing with you today as well. So let's get into our talk. In the United States, obesity, this is nothing new, right? But if you look way back in 1995, our lowest rate was 10% across the country. Our highest rate was 20% of the population in any particular state. Now, if you go, 3 decades later, look where we are, right? Above 40%. And, what our highest was then is now our lowest. But I love colors, okay? And I like color coding. So let's look at it. Way back in 1991. So if we look at that blue, that light blue color, that's less than 10%. Colorado, all of these states around here, less than 10% of obesity in their particular states. A lot on the Northeast and Georgia, surprisingly. I think they might have been cheating. But then we look a little bit later, so 1998 to 2000, we're seeing a lot more of this. Now we're 20 to 25%. So what do you think it looks like in the next one? Whoa, a lot of red. So 30 to 34%, and this purple is more than 35%. So these rates, this obesity, the percentages of obesity are going up in the United States over the decades, despite, what we're doing. So let's look, what are those consequences? Because if there were no consequences of metabolic disorders and obesity, we could just say, it's going up, but who cares? So number one, we have the metabolic issues. As we well know, as obesity rates go up, so does the risk of cardiovascular disease. So does the risk of type 2 diabetes, certain cancers as well, especially the hormonally related ones, because adipose tissue is very hormonally active. And then as well as you can think osteoarthritis. But it's also the healthcare costs are going up because now hospital stays are longer, surgeries are increased, diagnostic testing levels are up, and they're on more medications. Indirectly, those obesity expenditures, disability, okay, lost productivity, absenteeism when you can't go in because you just can't do it, but also presenteeism, which we're seeing more and more frequently, which means they're getting to work, but they're not able to do their best. They're not productive because of what's going on. Premature mortality, and of course, insurance premiums going up, exacerbating the health disparities. So if you're already diabetic and you're obese, and now you've got arthritis, we're getting wider and wider levels of issues. And then the impact on the quality of life, both physically and emotionally. And let me just share with you, my daughter is a fire medic. That means she's a firefighter paramedic. And part of their training is they strap on these 50-pound weights, packs, and then they do their workouts. They run upstairs, they do whatever they're going to do with 50 pounds on. Well, she threw it to the side one day and she just kind of, moves it around. And I decided I would pick it up, put it on, just to see what it was like to have this 50 pounds. And I tried, and I say I tried to walk up a flight of stairs. That extra 50 pounds was unbelievable. I couldn't breathe by the time I got to the top. I was exhausted, my back hurt. One flight of stairs. So yes, this weight, even though, someone who's gained the weight slower than actually strapping on 50 pounds, it's a little bit slower. They may acclimate to it, but it is a struggle physically as well as emotionally. So what are the drivers behind this? How has this happened? How did we let this happen? Well, one of them is this one. And every time I see this picture, I laugh. It looks a little ridiculous, but it is true. We're less and less active in general as Americans. We want to have everything the easy way. So, that dog's getting a great workout, the driver maybe not so much. But it's not just that. It's also what we're putting into our bodies. Like meals like this are very, very, very common, right? The supersize me kind of attitudes that many of us have. But not only are these not healthy calories, they're also inflammatory calories. But it's not just that either. It's also the toxins that our body is being exposed to every day, both from external things like pesticides, but also just the things that we put on our body, the chemicals that we put on our body every single day. So all of these things are contributing to this epidemic of weight gain. And if we look again, now we're looking at what we're spending on weight loss and weight loss products and all of the trends. And if we look back a couple of years, $135.7 billion. Okay, so we're already spending quite a lot of money. Last year, almost 160 billion. But if we estimate and look, it's extrapolated that by 2030, which is not that long away, 6 years now, I think, yeah, 6 years, $305.3 billion will be spent in the weight loss industry. Now, we see these numbers going up, so we're spending more, but we're not doing anything really to curtail that obesity and metabolic disorder that we're seeing so much in the United States. So let's look briefly at the evolution of weight loss medications, okay? Because we're so excited with what we're seeing now, and rightfully so. We are seeing some really spectacular changes, both in the metabolic issues with patients, but also in their weight, okay? But let's take a look back. Let's look at what happened. And each one of these years has a little icon inside. And what those icons mean is what we found to be the issue with them going forward. So in the 1950s to 60s, amphetamines were the thing, right? Looking back on it, yeah, they made you lose weight, but guess what? They were addictive. And when I mentioned about some of the nonsense that I used to do when I was dancing just to stay thin. Now, mind you, I was about 100 pounds. I'm 5'2", 5'3", well, 5'3" at that point. And I weighed about 100 pounds, but I was still big in the eyes of dancers. So I would go to this doctor, and the doctor would give me, for $25, he would give me a packet of pills. And me back then, I didn't even ask what they were. In retrospect, looking at how they made me feel, first of all, they made me go to the bathroom a lot. So there was probably a diuretic in there, and they gave me a whole lot of energy. So it probably was some form of an amphetamine, okay? Ugh, I can't believe that I was doing that. And I can't believe the physicians who just gave it to me, because at that point I was 18, 19 years old. So anyway, so we know that that's not a good idea. These are addictive. Then we get into the 70s when we had fen-phen. This actually had heart issues, and that was taken off the market. So that's another one. Going into the 1990s, orlistat. So this was looking at fat. And so a lot of people had GI distress, really fatty stool, and had issues that way. In the 2000s, we had sibutramine. And this one was a little more worrisome because this one was now affecting their heart. So this one was, removed. Mid 2000s, believe it or not, this is when the first GLP-1 agonist came out. Okay, way back in the 2000s. And just like they do today, their biggest issue is that GI distress. And we'll be talking a lot about that. Next decade, we see lorcaserin. This one actually had a cancer risk. So this one was totally pulled off the market. And now present today, we've got the GLP-1 GIP agonist. And we're looking at these with great respect, but we don't know. We don't know what the long-term effects of these are going to be. We're actually looking at some, and I didn't even put them on here yet because they haven't come out on the market, but actually looking at triple. So having 3 different agonists mixed together. And I'll explain a little bit later why we're looking at those at this point. So what are these things? What are incretins? So incretins are glucose and energy regulators. So when you take a bite of that big burger, and it doesn't matter whether it's a big sirloin burger or it's a big black bean burger, you're taking a bite of this burger, and what happens? Your blood sugar increases, and your body will shoot out insulin to start lowering that blood sugar. Well, what makes it do that? One of those things are the incretins, those gut-derived hormones that will reduce that blood sugar by enhancing the insulin. Now, the important thing about the incretins is that they're very, very, very fast acting. So within 3 to 5 minutes, they're done. Okay, 3 to 5 minutes, and their action is over. Very, very quick acting. because they're rapidly degraded. So what were they? The GLP-1s, which is glucagon-like peptide 1, the GIPs, and I'm not even going to say this long one. I just call it the gastric inhibitory peptide, and OXM. So remember, these are parts of our body. These are hormones our body already makes, but they are very, very, very short acting. Okay. And the agonists, however, so we looked at this, scientists looked at this, medical physicians looked at this and saw, wow, look at the results we have with these things. Let's try and duplicate it, but make them longer acting. So the first ones that came out, right, the ones like exenatide, these all had, you would take them twice a day because they lasted longer than that 3 to 5 minutes, but they didn't last an entire day. So you started taking them twice a day. As we know now, the ones like semaglutide and tirzepatide will last up to almost a week. Those responses last almost up to a week. Okay, so the same sort of responses that we're going to go over right next will last a lot longer. So what are those responses? If a patient isn't diabetic, right? What are they coming to us for? They're coming to us because they want to lose that weight. They've got that higher BMI, and they're struggling. And so they're trying to lose weight. So the two things that they're coming to us most likely for are these two things right here. So they want their appetite decreased so that mouth hunger that so many people struggle with is gone. They don't want to eat anymore, okay? But also it's increasing lipolysis. So it's breaking down fat and they're not hungry at the same time. What they may not really realize is that they're also improving their lipid profile as they're decreasing visceral fat. And many of us, most of us know that it's the visceral fat versus the outer fat levels that is more worrisome, more dangerous to us as a whole. So these two things are mainly what our patients are coming to us for. Now, I just want to say that the GLP-1s, the actual hormone, is made in the L cells of the colon. Now, for those who are diabetic, and even maybe for those who aren't, what's the impact on the pancreas? So it's going to increase insulin, decrease glucagon, with the overall effect of lowering blood sugar. But let's look at some other impacts that it has. On the liver, it's going to increase storage. So you're not making as much glucose as well because it's decreasing that. So again, lowering blood sugar. It's going to increase the flow of both salt and water from your kidneys. And it's actually going to decrease inflammation and decrease blood pressure. So it has some really good effects, at least as far as we know so far, on your heart. Lastly, though, and that's, remember, if you look back to those pictures, what did we see with the GLP-1s? It's that gastric issues, right? And so we're seeing decreased gastric emptying, decreased gastric motility. And even though it's making the mucosa of the microbiome a little stronger, these other two things can be very negative, especially if they are diabetic and already have a modicum of gastroparesis. So if they're already struggling with slow motility, taking these can slow that even further. And that can be a significant issue, right? So I won't go into all of these things with the GIP, the gastric inhibitory peptide, but just know the main things that are different is that it does have a good effect on bone. Okay, so maybe thinking about those with osteoporosis leading towards that might be helpful. Even better impact on the heart, same sort of issues with the gut and appetite. And the only big difference here is that it actually increases glucagon. So you go to yourself, well, that doesn't make sense. It increases insulin and glucagon at the same time. It doesn't really seem to make sense. However, glucagon has some other effects that are actually moderated by these GIP hormones, okay? So that's why both of them are going. And as a matter of fact, yeah, we'll just keep going. So a lot of people ask, between semaglutide and tirzepatide, which one wins the weight war, right? And what we're seeing when we're at the studies is that tirzepatide seems to be a little bit better at having patients decrease their weight without maybe the same sort of issues with the, without the GI effects. So anecdotally, we're hearing, yes, tirzepatide, better weight loss, not as much GI discomfort, but not necessarily being borne out yet in studies. Okay. Now, as I was mentioning, I was going to talk a little bit about, which aren't even on the market yet, but the triple agonists, these have even better weight loss. So far, what they're seeing is that the GI effects are decreased, but the most important thing that they're seeing is that the energy expenditure is improved. So one of the things that we see with people who lose a lot of weight, not only with extreme calorie restriction, but also with the semaglutide and tirzepatide, what happens often when they go back to eating? When they come off of these medications, what we often tend to see is that rebound weight loss. Why is that? Two reasons. One, they may not have changed how they were eating. Okay, the drug is making them not hungry, so they can't, but they're not really changing their lifestyle. They're not changing the way that they eat. That's number one. But the other thing that we know is that when you calorie restrict, which you are with these medications, when you calorie restrict, you are also decreasing energy expenditure. So when they go back to doing what they're doing, they're now at a lower rate expenditure energy-wise, and they have that rapid rebound. So if you've got a medication that can keep their energy expenditure level, even as they are decreasing what they're eating, the expectation is that you will not see that rebound after they come off the medication. Okay. So let's talk briefly about the gut-brain axis as a review. The gut-brain axis is that two-way bidirectional connection between the gut and the brain. It's involved with both our emotions and our cognitive functions. And, I like to joke and say that the lay person knew more about that axis than we did until recently, right? Because think of all of those things that we say. We say, I had a gut feeling about that person, or I had butterflies in my stomach when I was very, very, very excited or something of that sort. So we know these things. We know about that connection. Let's go a little bit deeper. What is that specifically? And let's see if I see something in chat. I think something just came up. Nope. In that gut-brain axis, it's mainly the vagus nerve, right? That vagrant nerve that's wandering throughout the body, starting at the base of the skull, innervating all sorts of things, our liver, our lungs, our heart, all the way down to the distal aspect of our colon. All of these aspects are being innervated by the vagus nerve. We have the hormone pathways there. So serotonin, the GLP-1s, the GIPs are all related to these things, to the gut-brain axis. And as we know, there are more fibers and more messaging going from the gut to the brain than the other way around. So it kind of makes you wonder, what really is the first brain and the second brain? Who's really controlling who? It's our immune system. So systemic inflammation and immune response is about 70%, it's estimated, of our immune system is housed in our gut. And then finally, it makes all of the metabolites, the short-chain fatty acids that are food for our colonocytes. It's the vitamin K, the B vitamins, which are so critical for our energy expenditure. So if your gut is not working well, your energy is not going to be working as well either. Okay. Let's look at what the microbiome looks like on stress, okay? Because this is key, okay? And a lot of times we think of stress as being that external stuff, the bills and the money and taxes and everything coming from externally. But our body makes its own stress. Stress is also from the inside out. It's just the act of living is a stress. Not all of it is bad, but it is a stress as well. So what happens when we have stress? Number one, we have the direct response. Immediately, we're talking about the bad stress, not the good stuff that, that's also there, not the eustress, the eustress, but the really negative stress. So the first thing that we can see almost immediately is an altered composition and function of the gut flora. Okay, almost literally within 24 hours or less. Okay, that then leads to increased intestinal permeability. Okay, and that's a thing that we didn't really understand until just recently. And I'll show some pictures that really kind of explain that just a little bit more. That leads to, so as we get more permeable, we see more LPS, lipopolysaccharide, which is coming from the external exoskeleton of the gram-negative bacteria. We see more inflammation. We see impaired immunity, which leads to changes in the neurotransmitters, the vitamins and the hormones that we just talked about, right? That would be bad enough if it weren't for the fact that there is a negative feedback loop. But when we have, which means, as you get stressed, your body say, okay, I'm stressed, let me shut this down. Let me shut down all of these bad responses. But when you have that chronic stress, that kind of gets shut off. And so it exacerbates that stress response. You have the increased risk of anxiety and depression because now, for instance, you're not making the serotonin you should. The serotonin that's keeping you, keeping your gut working well, but also keeping you from being anxious, from being depressed, from being unable to sleep, okay? But then also increased corticotropin releasing factor and cortisol. So the more you have cortisol, that unrelenting cortisol, you're increasing your risk of inflammatory bowel disorders, okay? So what we want is this, right? We want a healthy gut. What does that look like? The colonocytes are healthy looking. They're plump. They're very tight junctions between, so nothing's getting through. And I don't have it in the picture here, but there's usually a beautiful mucosal layer here that acts as a secondary barrier, actually the first barrier for nasties getting through. This is what we want. This is when our body does well, when our gut is healthy, okay? But when we have that constant stress, when we have issues that are always working at it, as I mentioned, stress, the toxins and the chemicals we talked about, gluten in some grains, some people are very sensitive to gluten, excessive medications, and it doesn't have to be, it doesn't have to be antibiotics, it can be Tylenol, it can be birth control pills, excessive medications, food allergies and sensitivities, okay? So when I say food allergies, we're talking about you eat a shrimp and your whole face blows up. We're talking about those, but we're also talking about when you have, say, for instance, we'll say gluten, or even, a blueberry. There are people who are sensitive to blueberries. And when they eat them, their body perceives it as a stressor, as an invader, and reacts to it. Chronic infections, especially the low-grade ones. So if we see an infection and it's obvious, then we can do something about it. But those low-grade ones, those sneaky ones that continue, those work against us. And then, of course, the standard American diet. So when you've got all of these things working against you, what tends to happen is those beautiful tight junctions that we have, they loosen. The beautiful mucosal barrier we had is gone. The cells themselves get inflamed. A lot of lipopolysaccharide gets through, and especially that lipopolysaccharide will start to increase the macrophages. They're going to be putting out all of the interleukins and all of those inflammatory cytokines. Those then have that negative loop. So what does it look like? Stress makes us make cortisol going through the hypothalamus and the pituitary, makes us make cortisol, gives us that leaky gut. The cytokines go up, the TNF alphas, the interleukins, the interferons, the IL-6s. Well, IL-6 activates the HPA axis, so it's going back. That negative feedback loop is not working anymore. It's down regulating the receptors. So now you're seeing the cortisol levels are going up without the receptors doing what they need to do. and we see that negative feedback loop and that increased stress. So what happens is, I was saying, when the gut is dysbiotic, when the bacteria are either not in the right proportion, like we don't have enough of the good ones, or if the bad ones start really getting out of order, what happens with that, with the incretins, okay? Well, LPS, the lipopolysaccharides, increase GIP and the GLP-1 secretion. So it does. And it seems like, well, that shouldn't be too bad if it's increasing. But what we're seeing is that it's only working with the inflammatory aspect of these hormones. Okay, so you're seeing more inflammation, but we're not seeing that blood sugar lowering effect that we want it to have. Okay. So we then have what's another aspect of this dysbiosis is sleep. How many, if you'll put in the chat for me, how many hours of sleep should we and our patients be getting every night? Just put them in the chat. How many hours? Or you can, 6 to 8. Okay. Anyone else? So yeah, it's 7 to 9. So 6 to 8 is pretty close. I'm liking that. 7 to 9 hours. And when we get that, the reason that we need that, well, number one, dysbiosis. Okay. So if our bodies don't get that amount of sleep, we're going to see an increased risk of our gut health decreasing. Okay, automatically. But remember, this is all of the time that our body is detoxifying, both our bodies and our brains. This is when our body is clearing out. It's when our hormones are recirculating and recycling. So we need these hours to be able, and we need them in deep sleep, not just, you're up and down all night long being in the bed. We want those hours of sleep so that our body can heal itself and we're less inflamed and our brain works the way it should be working. Then we look at that combination between the microbiome and type 2 diabetes. And I just listed, this is just a small snippet of all of the studies that show that in that connection between the gut, that bidirectional connection between the gut and type 2 diabetes. So what we see on one side is that if you have a gut that is dysbiotic with certain bacteria, you are going to be more likely to be inflamed and more likely to be insulin resistant, and then more likely to become diabetic. But on the other side, we see that if you are diabetic, you are then more likely to start developing these issues with your gut that make it even more difficult to control your blood sugar. So one of the things that that we need to be telling our diabetic patients is, yes, we can give you the medications to support you. We can tell you about what to eat and everything, but we also very much need to help them to heal whatever is going on in their gut, because we're seeing with these studies, and as I said, there are so many more, we're seeing that this is causing issues in that connection. Okay, now let's look at the diet and how it impacts our neurotoxins and how our body is working. So depending on what you're eating and your microbiome, you will make tryptophan. Okay, so tryptophan can go one of two ways. If you are inflamed, so if you're eating those crazy, cheeseburgers and fries, if you are continually stressed, if you're not getting the sleep that you need, your body is going to go down the kynurenine pathway, right? It's going to go down the inflammatory pathway to quinolinic acid. And eventually, because now you're going to have a depressed mood, you're going to be more irritable. You're not going to be able to sleep as well. You're not going to be as resilient to stress. And your brain function actually decreases. Okay. If, however, and it really has a lot to do with all of these interleukins. So IL-10 is actually one of the interleukins that is anti-inflammatory. So if you've got enough IL-10, then you can start blocking that inflammation. Or, you can stop being stressed, start eating better, get the sleep you need. All of those things will then take you down the other pathway. So when you get to tryptophan is now going to turn to serotonin, right? Which we've already talked about is so critical as far as our gut health is concerned, as far as our mood, as far as our sleep is concerned. So really, really important. Why with sleep? Because serotonin turns into melatonin, and that's what's helping us to sleep. But it's also our circadian rhythm. It's our mood. It's keeping that positive outlook throughout life. It's giving us back that resiliency to stress. And finally, it helps our memory. So if for no other reason but to be in this neuroprotective pathway, to be, down this road instead of the other, we want to be able to control which way we're going. So less stress, better eating, and then supporting ourselves with the right interleukins. And that has a lot to do with probiotics. We can talk about that, or can have a lot to do with probiotics. We can talk about that a little bit later. So what are we going to do? Number one, and this is where, we know now that there's a connection between our gut, our microbiome, our stress levels, and our ability to make these incretins on our own, and also to respond to ones if we're being injected with them going along. So what do we first want to do? We want to start reducing our stress levels. If we could do nothing, if we could do absolutely nothing else for our patients and clients, but reduce their stress, help them to reduce their stress, eat better, and sleep, their lives would transform. They simply would transform. So we want to look at, how are they going to do that? Is it going to be through mindfulness and meditation? Maybe, some people like that, some people don't. A lot of the clients that I work with are more into the tech side. So they love having watches and rings and things that will tell them, okay, I'm stressed right now, or I need to do this right now, or I need to meditate or slow down. So whatever it is that fits in with their personality, whatever they will do on a routine basis going forward, then that's going to be the best thing for them. Sleep hygiene. We just talked about how important that is, right? So a lot of people who they first come to me and they tell me I can't sleep. The very first thing you want to do is ask them, what is their sleep hygiene? What does going to bed look like to them? What time do they go to bed? What are they doing before they're going to bed? And then one of the big ones that is so simple, so quick to change is, do they have a television in their bedroom? And I always say that the bedroom is for two things and they both start with S. That's it. Okay. So if it's not sleep or sex, it doesn't belong for one of those two. It doesn't belong in the bedroom. A lot of people, just by taking the television out of their bedroom, automatically start sleeping better for two reasons. One, they don't have that constant noise and irritation, but also it's the blue lights. We know that blue lights interact with our circadian rhythm. Okay. Room temperature. If it's too hot, if it's too cold, it really doesn't work. Telling them to take warm baths, especially in things like Epsom salts. And then finally, something like a protein snack. Some of the people that I work with will say that they're consistently getting up at 2, 3 o'clock in the morning. And the reason for that, as we may or may not know, is that that's when the hormones start changing around. When the melatonin starts lowering, the cortisol starts raising so that we can wake up in the morning. So it's not unusual. However, we're not really meant to be waking up at 3 o'clock in the morning. If we're doing that consistently, might it be hormones? It might, but it also might just be that you're hungry. Your body, if your blood sugar drops or rapidly during the night, your body's saying, oh, this is dangerous. I need to wake up and get a snack. Again, one of the people I was working with, and I'll explain why I love these now, and had a continuous glucose monitor, found out that her blood sugar was dropping, believe this or not, to 38 in the middle of the night. Okay, 38. That's dangerous. So just knowing these things. So if first thing, maybe have a little protein snack before you go to bed. Tell them to do that first. If they're doing all of the really good sleep hygiene and they're still struggling with sleep, then consider getting tested, looking at their hormones, looking at other levels, things like vitamin D. Okay. Their nutrition, avoid the SAD diet. Okay. Just stop. But if they're, if they don't want to do that yet, if they can't give up their burgers yet, then tell them to increase their fruits and veggies. Okay. If you eat more vegetables, you won't be hungry as much, so you won't eat as much of the other stuff. And eat whole foods. So foods that your body recognizes in their natural form. So a potato as opposed to a factory designed potato chip. Okay. Very simple. Look at the inflammatory markers, white blood cells, if they're extremely high, but also if they're extremely low. Remember, we talked about chronic inflammation. A lot of times with chronic inflammation, you see white blood cells that are low. So if they're consistently in the 3 range, you might want to look to see if there's something going on gut-wise or some other low-grade infection that their body has been fighting for a while. Look at their C-reactive protein, their homocysteine, their iron and ferritin, which is another great marker for chronic inflammation. But then do that metabolic evaluation as well. And as I mentioned, continuous glucose monitors. I love them. Pretty much everyone I work with gets one, even if they're not diabetic, even for a couple of weeks, because it's so eye-opening to see when I eat this food, this is what happens with my blood sugar. When I do this workout, this is what happens with my blood sugar. And then you can make adjustments so that instead of seeing those crazy spikes, up and down, they can sort of even out, get more insulin sensitive, which then makes it easier for them to lose weight, for them to get their A1C under control. And then make sure that you are looking at their fasting insulin, their A1C, their cortisol levels, right? We just talked about the impact of stress. So we want to look at those cortisol levels. And then finally, make sure that you're also looking at their thyroid function studies, their TFTs. And when you are, look at the entire panel, not just a TSH, okay? No shame, but if all you're looking at for thyroid function is a TSH, you're doing them a disservice and you're doing yourself one. You cannot get all of the information that you need from just a simple TSH. You need a full thyroid panel, okay? And then finally, look at the microbiome. That's what this whole talk is all about, right? Look at a comprehensive stool test. And this is, it's not going to be your first step, not necessarily, but if you've gone through all of these other things, you're still not seeing the answers that you want, get that comprehensive stool test, look and see what's actually going on with their microbiome. And then finally, for microbiome support, the first thing you want to do is that 5R gut healing. So remove, replace, reinoculate, repair, and rebalance. And then the second thing is, even if everything is completely normal, which it most likely wouldn't be if these things are out with their microbiome, then you want to make sure that their digestive enzymes, their magnesium, all the vitamins, zinc, and omega-3s are all optimal as well. Okay, so what is that 5R? Just as a reminder. So if you want to go from the woman on the left who's got gut issues galore to the one on the right who just loves her gut because it does everything she wants it to do, these are the 5 steps. Number 1, remove. So remove stressors like food. So if you know that your body is sensitive to, we'll say gluten, because that's a big one, right? If your body is sensitive to gluten, then take it out of your diet, take it out of your lifestyle for at least 6 weeks. Okay. And then you might want to try it back to see how your body responds, but give your body that break. If there are bacteria, if you finally got to the gut stool test, you found that you had a dysbiosis, your gut flora were all out of whack, you want to start removing those bad bacteria, okay, if you have some nasties in there. If you know that you're being exposed to toxins, things like mold, okay, if you're living in a moldy house, you can try to clean it out, to clear your body, to detoxify. But if you don't remove yourself from the source, it's no good. And then stress. We must learn how to reduce stress. Then you want to replace the things. So things like digestive enzymes that we just talked about, bile acids. And I tell people that everyone over 50, and so the first thing was removing those nasty foods, then everyone over 50 you start having decreases in these digestive enzymes, especially the ones like hydrochloric acid. So again, if someone doesn't want to take a pill, if they don't want to take a digestive enzyme, start with something as simple as a teaspoon or a tablespoon of apple cider vinegar. Again, just simple little things can be so amazing in how they respond. Next, you might want to re-inoculate at this point. So you know what's going on with them. You've taken away the bad ones, but now you want to replace them with good bacteria, especially ones like Akkermansia, which is huge for your insulin sensitivity, okay? You don't necessarily have to take a probiotic, although, a lot of people want to do that. Things like kimchi and fermented foods are going to be great for giving you back those probiotics as well. Okay. Remember, once you start the probiotics, you want to also add prebiotics, which are the food for the bacteria, for the good well, let's take a step back. Prebiotics are not picky. They will feed whatever bacteria are there. So if you start with prebiotic and they still have some of the nasties, you're going to be feeding the nasties. So you want to make sure that those are all gone and make sure that you've got the good bacteria that you want, and then you start feeding those to increase those levels. And then we want to repair. So you're now, remember that we talked about that beautiful mucus layer that the body should have, that the gut should have as that first layer of protection. We want to start rebuilding that. And we can do that with L-glutamine and then those vitamins A, D, zinc, and the omega-3s. Those are all going to help with that. And then finally, again, you want to rebalance. And by that, you want to make those lifestyle changes that brought us to this issue in the first place. So the sleep, the stress reduction, and hormone balance. Okay, that's a room for a whole nother talk about hormone balance. But all of these things are going to help us to maintain this gut healing. Because again, just like with mold at the beginning, if you don't take yourself out of that environment, if you continue with the high stress levels, all that happens is that you heal and then you unheal. And then it's just this cycle of good, bad, good, bad, good, bad, right? Okay. So let's just start with a little case study so we have a few minutes for questions if you have. So this is a 57-year-old woman of mine who had a lot of issues. And it's interesting, the thing that actually brought her to me. She has a lot of stress in her life, a lot of GI distress, bloating, alternating constipation and diarrhea, which was frustrating because she would be constipated, she would take something and then she would be, have diarrhea. She'd just go flipping back and forth. And that's more common than you would think. Okay, not sleeping well. So now we already know she's got 3 issues already going on that are making it difficult for her to lose weight. And now the thing that actually brought her in was that her doctor told her 2 things. Number 1, she is now pre-diabetic. Okay, she was hovering on that A1C of 6.34. So she's got that going on. And she was also told that a few more pounds and she was going to now be considered morbidly obese. Those 2 things were like, I'm done. I need to make a change, right? She tried, with the help of her doctor, tried to use the GLP-1s, but wasn't able to. They just made her sick as a dog and she just couldn't. So she came to us and we took her through that 5R, the gut restoration, made some other changes with her. And here's what we saw. We rebalanced her gut microbiome. Okay, that was the number 1 thing because her commensals were all out of whack. She didn't have any bad bacteria, the things like the nasty, like C. diff and things like that. She didn't have that, but she did have a very low levels of the good commensals, the good keystone bacteria, and a few of the ones that were more opportunistic, the ones that will kind of sneak in there and wreak havoc if they can. They're not the nasty nasties, but they will do that. So that all rebalanced. She had a reduction in that gut inflammation and all of the bloating, the constipation, diarrhea, that all resolved. That was enough to make her happy, okay? But her sleep improved. She lost 15 pounds without trying. Okay, so now she's not, she's not specifically struggling with any kind of weight. She lost that 15 pounds and she was coming a step away from that diagnosis of morbid obesity. And the main thing was that unlike just the straight injections, now she was able to tolerate, what she was going on. So she was able to tolerate this going forward and understood that this was something simple to turn into a lifestyle that she could continue going forward. Okay. So I have a question for you, actually a favor to ask of you. I love to do these talks and then answer questions, but also to get feedback. What was good? What did you understand? What was of that sort? So if you'll scan that QR code, and it will ask you 5 quick questions. If you do that, and then put in that code SLEEP, what I will do is I'll be sending you a PDF on how to get better sleep. You can share it with your patients and clients. You can actually even listen to it yourself or look at it yourself, but it'll give you some ideas of, what are the things we can do to start getting better sleep immediately without necessarily having to take melatonin or some stronger medication to be able to do so. So I'll leave that on there for a second, and then I'll do my little final wrap up. And then we'll open up for questions. So we have a little bit more. I'll wait 1 second more, and you can just kind of go through that. So as you're doing that for me, thank you so much. Let's just recap. Okay, so number 1, we need to take an integrative health approach. So we need to look at the stress levels. We need to look at the gut microbiome, and we want to know what about the hormone dynamics. So we need to do them all together if we want to see the best results for their metabolic health and well-being. Okay. The gut-brain axis is so important. It's not just enough to give a medication that's going to, change whether you're hungry or not, or change how your gut is responding. All of those things, that axis is so, so, so important. So we want to make the dietary changes that are necessary. The stress reduction is needed, and the probiotics, if they actually need them. Okay. You saw that timeline, of things going along. And the incretins that we have now, the GLP-1s, the GIPs, and now these new ones that are on the horizon have such a potential to change the way we manage metabolic disorders. But we need, and I just want to say, we need to be careful because we don't know the long-term effects yet. Okay. So the other big important thing is that we need to be able to support their energy expenditure. Remember what I said, when you decrease your intake drastically, food intake, energy expenditure also decreases, which is why they have that rebound. So we need to be able to figure out how to support both the decrease in food intake, but also how do we support their energy expenditure so we don't see that rebound. And then finally, targeted supplementation. And if you'd like, we can talk about some of the things that I use, some of the things that I recommend specifically, but we want to be able to optimize their gut health, to optimize their sleep, and that a whole gut-brain communication that we see all of the time. So I'd love to open for questions, and I'll leave that if you'd like to connect with me. That's my cell, my LinkedIn, and my email. I'll leave that up there.
I must say, amazing presentation. I have so many questions for you right now okay. from the viewers. I'll start off with this one. So in your experience, how effective are lifestyle interventions in improving gut health and metabolic outcomes compared to relying solely on GLP-1 agonists?
Oh, love that question. Let's put it this way. If we could get our patients and clients to make those lifestyle changes, I would estimate that 90% or more wouldn't need the GLP-1s and the others, okay? If we could get them to do that. That's the whole, shall I say, the boogaboo, the stumbling block. So what I do in my practice is I will talk with them and have them understand that I am not putting them on these medications long-term. It's might be 3 months, 6 maximum. But as they're doing that, they're making their how to make these lifestyle changes so that as we start decreasing those, the dosages, we don't see that rebound because they're already moving more. They're already sleeping better. Their hormones are already in balance. Their gut is already healed. So we got to make those lifestyle changes either concurrently, if they're not able to do them or don't want to do them initially.
That makes sense. So this question, I have to be agnostic. However, the audience asked, what blood test do you recommend we can use via Access?
Okay, so as I mentioned, we want to do that baseline metabolic panel. Okay, we don't have to go into, and I love the weeds, but we don't have to start in the weeds. Okay, so the complete metabolic panel, absolutely. We want to know what their A1C is, absolutely. We want to do a fasting insulin, and that is because your fasting insulin can actually become elevated or go above 5, which is really where you want it to be, can go above 5 long before your A1C changes. Okay, so you're able to put out that insulin first and keep your blood sugar down, keep your A1C down until you really start creeping up towards that pre-diabetic range. So looking at that fasting A1C. The other ones that I had mentioned, looking at their TFTs, you want to know all of those numbers. Their white blood count can tell so much. Looking at the lymphocyte neutrophil ratio and whether they have eosinophils. So all of those baseline labs that you start with, that you should be starting with, have so much information in them.
Beautiful. And all of those, you can get results back the next day. How was that?
You sure can.
So let me ask, how would you balance the immediate benefits of GLP-1 medications with long-term goals of helping patients achieve a sustainable health through holistic approaches?
Right, right. So, I tell people about what is the TV show, The Biggest Loser, I think it was.
I've seen the
So
break.
where they would have people lose these amazing amounts of weight and everything. I mean, it's just like spectacular. And then you follow them 3 to 5 years later, and they've all not only regained it, but most of them have regained and rebounded higher than where they started. Why is that? Two things. They were learning unsustainable ways to lose the weight. And two, they were dropping that energy expenditure so drastically during that period. So those are the two things that make it impossible for them to maintain it. If we flip that, if we teach them the lifestyle as we're going along, as I was mentioning, and maintain their energy expenditure, then they can come off these medications. They don't have to be on them for life, which is, who wants to inject themselves, even if it's just once a week? Who wants to do that for the rest of their life either? So that's what we stress with the patients and clients I work with.
I love it. You're dropping gems on us. You are. What strategies do you use to educate your patients, right, about the connection between the gut health and the effectiveness of the GLP-1 therapies?
So other than what we just talked about, my other big thing is I always have them do a food mood activity journal. And the reason for that is a lot of people really don't know how they feel until they start writing it down. So I'll have them say, okay, on Monday, I ate this, this, and this. I felt like this. I slept like this. I had this amount of energy. And they do that for about a week or so. Then they go back and they look at it. And they start seeing connections between, oh, I ate this cheeseburger and a day later I was wiped out. When you start seeing those connections, then you're able to start making those lifestyle changes that make it easier.
Beautiful. And how would you approach cases where your patients are experiencing possibly adverse gut-related side effects from the GLP-1 medications, which we know can happen? And what alternatives do you typically explore?
Okay. So most of the people who come to me, if they're on them, they get Zofran, ondansetron, from their from their doctors who's ever giving them the GLP-1s. And it does work. It cuts the nausea, but you want to look at it also from the end of what can we do to support the gut to help itself, okay? And to do things like that, I will make sure that the digestive enzymes are there, that the bile acids are there, that their hydrochloric acid is all working well. These are the things that we look at first, the things that will soothe the gut as well. So like lemon balm, things of that sort. We want to make sure that all of those things are in good levels before we start doing all of the actual medications per se.
Beautiful. And have you heard of microdosing GLP-1s? Is that a thing?
Yes, you can you can microdose them as well. Less side effects. We're still kind of playing with how it's going to respond, especially with respect to their weight loss. But yes, it can, especially in the beginning. Mhm.
Perfect. Well, Dr. Lovelle, I mean, amazing, amazing presentation. And on behalf of Access Medical Labs, thank you again for this amazing lecture on GLP-1, the boom, and the gut microbiome's role in the metabolic dysfunction. To our audience, thank you again for tuning in to another Access Live, where we bring you insight from leading medical experts. Don't forget to like, subscribe, and stay healthy. Dr. Lovelle, thank you so much. Until next time.
Thank you. Bye-bye.